On this episode, we will talk about having IBS and having weight loss surgery. Does it make it better? Does it make it worse? We'll also talk about having blood clots in the past. Can you get weight loss surgery? And we'll talk about why do we remove 80% of the stomach? Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 186 of the AskDrA show. Thank you for joining me and thank you for sending us your questions. And if you want to send me your questions, you're more than welcome to do so. Use the hashtag AskDrA throughout social media. That way my team is able to grab those questions, line them up, and I'll be here to answer them. If you're interested in weight loss surgery, or the gastric sleeve, you might consider subscribing to the channel because I know you'll find the information useful. Let's get into the show. Okay, Dr. Alvarez, so I do have IBS. My concern is having IBS, and if I get gastric sleeve, does it make it better? Does it make it worse? I really don't know. Well, the vast majority of the patients get so much better with their IBS. By the way, IBS, irritable bowel syndrome. Their symptoms, pretty much, they all go away. So this is very well documented. Having weight loss surgery makes IBS symptoms so much better. So this is very well known. One big factor is having weight loss surgery, either a gastric bypass or gastric sleeve. Well, as you know, you will diminish, you will lower the amount of food intake a day. You will lower the amount of food that goes through your GI tract, and this lowers as well the IBS symptoms. But of course, losing weight, here's another thing, losing weight will lower your inflammation in your body, your chronic inflammation, just by being obese. Everybody has it if you are overweight, and lowering your body weight will lower your inflammation in your body, making symptoms as well much better. Okay, and then we have a second question where a patient says, I've had blood clots, or I've had a deep vein thrombosis, or I had a pulmonary embolism in the past with a related surgery, or isolated, I developed blood clots. Can I get surgery? The answer is yes. We've done it many times. But, there's a but. But we need clearance by your doctor if you are taking blood thinners, if you are under certain medications to prevent this, if you have a certain filter inside your cava vein. What happened in that event? I mean, something that I need to know. And this is something that by filling out one of our health history questionnaires online, we can help you with that. But vast majority of the patients, we work side by side with your PCP or your doctor back home to make sure you are at a good condition to have surgery. Of course, if you had these events, we use blood thinners on absolutely all our patients. We use leg wrappings on all our patients. We use the leg compression, the stockings that massage your legs during surgery, in recovery, in your room, just to lower the risk. Doesn't mean you're immune to it, but it will lower it to the minimum. And the reason we do this is because we have a protocol. We are a center of excellence. We need to lower the risk of absolutely everything, make it as safe as possible. But if you still have any questions, feel free to contact my office and I can let you know. And the last question of the show is, why do we remove exactly 80%? What's of the stomach in the gastric sleeve? It really isn't 80. It could be 82. It could be 75. It could be 70, because at the time of surgery, we go in, I don't know how big or how's the shape of your stomach, or if it's too big. If I craft your stomach, your percentage will be higher. If your stomach's much smaller, the percentage will be less. So just don't focus on these specific technical details. Leave it to the surgeon to craft what's best for you at the time of surgery. What I can tell you is the calibration of the sleeve, 80%, or whatever's going to be done in your case, or what was done in your case, it's to your needs. It was a procedure crafted to your needs. And I tell patients, not all sleeves are equal. I mean, it's artwork. So it depends on the passion you put into that procedure and therefore the results. If you cut too less, patient won't lose enough weight. If you cut too much, patient will look into maybe certain complications. So it's a procedure crafted, personalized, and artwork. All right, so there you have it. That is it for episode 186 of the Ask Dr. A Show. Thank you for joining me, and don't forget to send me your questions. If you like the content, leave me one of these. Very useful. I appreciate it. And don't forget to subscribe to the channel if you find or you're into weight loss surgery or gastric sleeve. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.